2 with the amazing Natalie Stake-Doucet. I hope I said your name right.
Thank you.
Okay, so we know that Natalie does so many great things. I would love if you could tell our listeners a little bit about what you do.
So I'm a nurse. I'm a professor at University of Montreal, and I'm first and foremost an activist for nurses' rights because nurses are not recognized, are not paid, are not valued, and we are literally the backbone of healthcare. That's what we're seeing right now in Canada. It's not a healthcare crisis, it's a nursing crisis. Without nurses, you have no healthcare. So everything is really nurses are leaving because they don't feel nurses are leaving because they don't feel respected, because they don't feel they're getting what they're worth. And so, I'm there in protest, advocacy, lobbying, everywhere. You name it, that's what I do.
Yeah, amazing. We're always so enamored to meet you and to hear, what you have to say. If you were speaking to your younger self or a younger nurse that's coming up in this generation, seeing all of the things that we're seeing, again, we're talking to international nurses. What message would you say to them right now in terms of advocacy?
Well, actually, one thing that's great about teaching is I get to meet new nurses all the time. And I got to say, the new nurses today, like student nurses today, are way ahead of where I was when I was a nursing student. They're talking about, there's real discussions about, paying for clinicals, because nursing students do a lot of work in hospitals, and they should be paid for that work that they do. And so that's a discussion we would have never even thought to have, 10, 15 years ago when I was starting as a nurse. And so they help me a lot, actually. They inspire me every day, and they give me a lot of faith in the future because they know what they're worth and they won't accept anything less. And so, there's still a lot of sort of mythology in nursing where you feel you have to be self-sacrificing. You feel like, you feel guilty for taking your breaks. And, if we have breaks, it's for a reason. And so it's still a big part of what I do, making sure that the structures in healthcare that are still very oppressive towards nurses, to give students some tools to protect themselves against that, So maybe not start out working full-time right away, to give yourself time to breathe, make sure you have days off where you can just chill, talk to your family, your loved ones, and make sure to really decompress. And also to not feel so much pressure to do overtime all the time, because that really eats away at your soul long term. With new nurses, what I basically tell them really is take your time. It's okay to take your time. Don't feel guilty, and don't let anybody make you feel guilty for wanting a life outside of work. That's my main message, I think. Yeah.
Yeah, I think that's really inspiring, because as nurses, we're always taught to care for patients. We're taught to advocate for patients. We're not taught about self-care or self-advocacy, but I think these are skills we all have as nurses inherently. If there are nurses out there that want to start advocating, but they're afraid or they're not sure how to get started, what would you say to them?
A lot of nurses are still afraid taking that step into advocacy. I mean, both of you know for sure it's not always well perceived initially, but I think you're absolutely right. Nurses have that capacity. We're just afraid to use it for anybody else but ourselves. Or actually, rather, we're afraid to use it if it's not just for patients. So I think we have a lot of power that we don't use and that we don't realize that we have. And when that power isn't used, it's misused. And so it's very important to actually understand the importance that nurses have, because if we let the healthcare system diminish our importance, and if we start buying into that, then we also minimize the influence that we have. And that's how, issues like systemic racism become so important within nursing, because we let that myth that nurses are just nurses, it allows us to excuse, a lot of negative things, because we feel like we don't have power, but we have a lot more than we do. And it's important to be conscious of that, because with great power comes great responsibility, as Spider-Man would say, or Spider-Man's uncle. And I think we have to really own that power, and that means the good, the bad, the ugly, everything that comes with it. But it's a very liberating experience. It's something to really glory in, because power dynamics are complex. Healthcare is immensely complex. Society is complex. And so starting to look at all the moving pieces and find our place in there and really look beyond stereotypes and look beyond, gendered stereotypes especially, really helps us get a much clearer view of what nurses do, the importance of nursing, and it allows us to be better nurses in the end as well.
You know, one thing that you said that really struck me was that whole aspect of power. Like, if we don't use it for ourselves, someone else will step into that place. Someone else will be that person who uses that power. And I think that's so important for us to remember. Like, if we aren't the ones that are going to step up to make the change, someone else is going to step into that place. So I think that's such a really important thing for all of us nurses to kind of think about. And kind of along that vein, so there are many powerful nurses here today, all across the world. What is it that you expect to get out of the ICN Council while you're here?
Well, that's a loaded question for someone like me. What do I expect to get? I mean, honestly, I'm here to network. I'm here to strengthen relationships that I already have. I'm here to, hang out with people like you, because that's something my soul needs, to be with other nurses who also think activism and advocacy are a fundamental part of nursing. But this is probably not the majority of nurses here. There's more and more, I think, but nursing itself is in a lot of ways very conservative. And so nurses like us or groups like us start, making a little bit of headway to convince other nurses that advocacy and activism are an important part of nursing and can take many forms, from podcasts to protests to lobbying MPs to, however you want to do it. But there is still often a lot of reticence on political issues for nurses, and that makes me not happy. If we look at just yesterday, it was a beautiful opening ceremony, and it was all great, but then there was this beautiful land acknowledgement, and then everybody was wished a happy Canada Day. And to me, that's an obvious contradiction where, you have, on the one hand, you have a great land acknowledgement, but then, a few sentences later, you're still celebrating colonization. And so, Canada is 156 years old. So yes, some people will celebrate, but for Indigenous people in Canada, that means, 156 years of resistance against genocide, against colonization. So, I think there's going to be a lot of different things. Again, like anything in this society, there's many different sides. There's a lot of people here with all kinds of different experiences. There's a lot of people in formal leadership positions. There's other informal leaders like us, for example, that are really sort of shoving our way into different things and making our voices heard. But that's what I like about these congresses or these conventions, is you always find people like you that you wouldn't find any other way. People that have sort of shouldered their way into these spaces to have their voices heard, and that's the people I want to meet. That's the people I want to hang out with, and I hope I'll meet a bunch more, and that we'll meet a bunch more before we leave.
Wow, you have done so much great work. I think there's so much we could learn about you, and you've done some really great opinion pieces too. So if anybody wants to look up Natalie Stake-Doucet, check out her work. Can you let people know where to find you?
So I am now a associate professor at University of Montreal. So happy, finally. Thank you. So after many, many years of precarious work, I finally have a full-time stable position, which is really nice. So my email is basically my name, natalie.stake-doucet @umontreal.ca. And you can find me on Facebook, Natalie Day, or on Twitter, Dr. Nurse Nat. And I'm so happy to see you guys. You're both an inspiration to so many people here, and it's nice to have Toronto nurses in Montreal. Welcome to our town. We love having you.
I'm so thankful that we found you as part of our community, and we were able to meet face to face. So thank you so much for joining us today.
Thank you.